nobody may actually die of overwork, but may die of consequences of overwork, not getting enough sleep, not getting the right time to eat. For every 1 rupee you invest in mental health support, businesses see a return of 4 rupees. That is 4 times what you invest. For example, Asana has no meeting Wednesdays to give employees uninterrupted time to focus and reduce stress. Hi, I'm Dr. Sunil Mittal, Head of Clinical Governance at Better Place, where every day is a mental health day. And I'm going to give you some actionable ideas to improve the mental health of your employees, whether they are in a corporate office or in a factory floor or out in the field. We know there's been enough conversation in the recent years about the mental health of employees. But the question that I'm often asked is that as an employer, what can one really do that's effective beyond the regular EAP programs? EAP programs often don't even work because employees are either afraid of admitting that they need help or are simply not taking it seriously. They run of the mill and often do not provide specific solutions. Having worked with EAP programs, I understand this, that you can't have the same counselor speak to thousands of employees with a multitude of problems. Yes, it can be a sort of a gate through which people can enter into therapy or seeking help. But then by itself, it has its own limitations. And what's required are very specific tools or programs to address these issues. Start by creating a safe space for your employees to talk about their mental health issues without fear or judgment. A safe space could be a physical room for private conversations or a virtual anonymous platform where workers can voice their concerns and talk about what their issues that they face. Where in some organizations, simply starting the conversation about mental health can make a world of a difference. And it could be your HR department, it could be mental health experts who can come in and help you start this conversation. And when employees feel supported, they are twice as likely to be engaged in and 3 times more productive. Now, look at your policies. Build in mental health into your policies, offering flexible hours, mental health days, leave for accessing mental health services, or even access to high quality mental health services on the premises of your workplace makes a huge difference. Workplaces with mental health support have 25% higher employee retention. Some companies abroad are leading the way with innovative strategies. For example, Asana has no meeting Wednesdays to give employees uninterrupted time to focus and reduce stress. And Google offers flexible wellness budgets, allowing employees to use them for therapy sessions, fitness classes, or meditation apps. This isn't about pampering the employees. It's about ensuring your team performs at their best. And when your team performs, when your employees thrive, your businesses thrive. For every 1 rupee you invest in mental health support, businesses see a return of 4 rupees. That is 4 times what you invest. And that's because employees who feel supported are more focused, take fewer sick days, and work more efficiently. While any organization can get a mental health professional to start a conversation or can have one of the employees begin a conversation, it actually falls on the leadership, the CEO, the person heading the organization to begin this conversation. Because once the CEO starts speaking about mental health issues, conversations then become huge and everybody gets involved. You know, there are enough celebrities who have come out and spoken about their mental health issues, and they're not being judged. Similarly, if there was enough space within an organization where employees could speak without the fear of being judged, or being penalized, or being pushed into taking sick leave, or being pushed all the time by saying, well, just get up and start working. If they feel supported, if they feel they have access to mental health care, then your business grows. Having worked with larger organizations, I know this, that if mental health is built into the policy, if the top management speaks about it, everyone in the organization fearlessly speak about their mental health issues. And let me tell you, it's not that they would be faking, because if you have mental health services, the experts would know whether the person is faking or not. So it isn't that you start a conversation and there'll be now a lot of people faking mental health problems and applying for leave. On the contrary, the moment you start a conversation on mental health, people who have actually been having their inner struggles, they have been suffering, they come up and speak, and your productivity goes up. Employees facing mental health challenges are 3 times more likely to take sick days and 4 times less productive. Not because they are lazy, they are just struggling. In the year 2023, workplace exhaustion in India hit a whopping 62%. About 4 out of 5 employees report burnout, which means they are stressed to the point of needing professional help. And if an employee reaches a breaking point and quits, replacing them can cost as much as twice their annual salary. Nobody may actually die of overwork, but may die of consequences of overwork, not getting enough sleep, not getting the right time to eat, not eating healthy, not getting exercise, having a burnout, and being on job 12 to 14 hours a day, or receiving emails at night and expecting them to be answered, or receiving projects which have actually foolish deadlines. Finish it by tomorrow morning, expecting employees to sit through the night and then finish those projects. And then there's this whole glorification of working 72 hours a week, 100 hours a week, 120 hours a week. Hey, you're not in the army where you're on duty like that, or you're not working in emergency services where you are working just endlessly. You're working on high quality projects that require cognitive alertness. You're working with heavy machinery that requires people to be alert and attending to what the task they're carrying out. And if you don't have those rests, your mind doesn't get rest, you can't get sleep, your body is not functioning, then the accident rates are going to be high. And the compensation payouts are going to be higher for the company. Think about it. When employees feel mentally supported, they are less likely to call in sick. They finish tasks faster and they respond better to feedback. That's the real return on investing in mental health. But what happens when you ignore the signs? Well, we know this that in any group, the general population, 1 in 5 persons is going to require mental health help. Your organization is not an island. 1 in 5 in your organization, in your team, is going to require mental health support and help. That is what the statistics are. That's what human beings are. Tragic outcomes may happen, like the rising cases of severe mental health issues amongst employees, or substance abuse rising, alcoholism rising, or burnout is one, of course, the commonest thing that one can notice. All this shows us what can go wrong when employees are silently struggling. It's not just about missing deadlines. It's about missing the cry for help. In 2023, 78% of employees reported feeling burnout. That's more than 3/4 of your team. If you're noticing people taking longer to finish tasks or making excuses for time off, it's not them being lazy, it's burnout in action. Employers are often worried about absenteeism when their employees take off because of health reasons, including mental health reasons. I think they should pause and also think about presenteeism. When employees are present, but they're not productive. It isn't about getting your employees to stay in office 12 hours in a day or 3 days in a row or 6 days a week. It's about how much work that they can do productively, efficiently, in the best possible manner, in the least possible time. I think that's where one needs to think.